When a patient is diagnosed with breast cancer, they are immediately thrust into a terrifying, overwhelming world of complex medical terminology, aggressive treatment protocols, and profound psychological distress. Among the myriad of fears that accompany an oncology diagnosis, one of the most universally devastating concerns is the prospect of chemotherapy-induced alopecia, which is the clinical term for profound, rapid hair loss. For decades, losing one's hair has been the universal, unavoidable physical hallmark of the cancer patient. It is a highly visible, undeniable physical transformation that strips patients of their privacy, broadcasting their illness to the entire world and deeply fracturing their sense of personal identity and body image. In recent years, the biomedical industry has offered a beacon of hope against this dreaded side effect, scalp cooling technology. Also known as cold capping, this FDA-approved technology involves wearing a tightly fitted, specialized silicone helmet that circulates freezing liquid before, during, and after a chemotherapy infusion. The physiological premise is incredibly elegant. By drastically lowering the temperature of the scalp, the device induces severe vasoconstriction, physically shrinking the blood vessels and reducing blood flow to the hair follicles by up to 80%. Simultaneously, the extreme cold forces the cellular metabolism of the hair follicles to drastically slow down, putting them into a state of biological hibernation. In theory, this dual mechanism prevents the toxic chemotherapy agents from entering the cells of the hair follicle, thereby preserving the patient's hair. Clinical trials have heralded scalp cooling as a miracle, but the practice of medicine is rarely as simple. There is often a massive, heartbreaking divide between clinical promise and real-world oncology. Today, we are going to dive deep into a highly significant, paradigm-shifting medical study that exposes the undeniable limitations of scalp cooling. We will explore the brutal cellular mechanics of combination chemotherapy, why cold caps often fail against specific drugs, and the psychological blow when medical miracles strike out. To truly understand why scalp cooling might fail, we must first look at the actual pharmaceutical weapons being deployed against breast cancer. Regimens are rarely single-agent. In standard real-world clinical routines, oncologists utilize highly aggressive combination chemotherapy protocols. The most common involve anthracyclines and taxanes. These are not ordinary medications. They are some of the most powerful, toxic, and biologically destructive compounds ever synthesized in medical science. Let us first examine anthracyclines, such as doxorubicin, which is so notoriously toxic and vividly red that patients grimly refer to it as the Red Devil. Anthracyclines destroy cancer cells by preventing DNA from unzipping. They inhibit crucial enzymes, causing DNA strands to physically break apart and shatter, triggering immediate death. Following the anthracycline phase, patients are usually given taxanes. While anthracyclines shatter the DNA, taxanes target the cell's physical scaffolding. Taxanes aggressively bind to microtubules and freeze them in place, paralyzing the cell completely and forcing it to undergo apoptosis or programmed cell death. When you combine anthracyclines and taxanes, you create a biochemical firestorm that is incredibly effective at eradicating breast cancer tumors. However, this combination is also catastrophically destructive to the keratinocytes, the rapidly dividing cells that build human hair follicles. The sheer toxicity is overwhelming. These specific combined drugs remain circulating in the patient's bloodstream for an extended period. And this brings us to the crucial breaking point of scalp cooling technology. Against the sustained chemical assault of a taxane and anthracycline regimen, cooling the scalp for a few hours is often biologically insufficient. The hair is destroyed anyway. This harsh reality was recently documented in a landmark study by researchers at the Medical University of Innsbruck in Austria, published in Breast Cancer, Targets and Therapy. The investigators wanted to look past sanitized data and evaluate the true, subjective, real-world experience of women using scalp cooling during these aggressive regimens. The study followed 75 women with breast cancer who opted for the Orbis-Paxman cooling cap system compared to a control group of 38 women. Researchers conducted rigorous psychological surveys to measure hair loss, functional health, emotional well-being, and body image at multiple critical points throughout treatment. The clinical findings were stark and deeply important. When the data was analyzed, researchers found absolutely no statistically significant difference between the groups. Let me repeat that. There was no significant difference in patient-reported hair loss, quality of life, emotional functioning, or perceived body image. The technology completely struck out. But perhaps the most heartbreaking statistic was the massive dropout rate. Enduring scalp cooling is not comfortable. It involves a freezing, wet helmet for hours. It frequently causes severe, migraine-like headaches, profound chills, and claustrophobia at a time when the patient is already feeling incredibly sick and vulnerable. According to the study, a staggering 70.7% of the women who started using the cooling cap stopped early. They abandoned the technology completely. Almost 74% cited severe alopecia as their reason. They endured agonizing discomfort only to watch their hair fall out in massive clumps anyway. The implications cannot be overstated. When a patient is offered scalp cooling, they are offered hope, the expectation of normalcy while fighting a deadly disease. When it fails, they experience a psychological double blow. They suffer the trauma of diagnosis, treatment, physical agony, and the devastating grief of hair loss they fought so hard to prevent. It breeds a profound sense of failure, medical betrayal, and deep depressive frustration. So what is the ultimate takeaway for the global medical community? Does the Austrian study mean scalp cooling is a fraud? Absolutely not. It remains a brilliant innovation that has saved the hair of thousands worldwide on less aggressive regimens. However, it is not a universal magic wand. Oncology must transition toward precision medicine. We need to identify who will actually benefit from a cold cap. Medical professionals must have radically honest, scientifically grounded, and transparent conversations about the limitations. A patient deserves to know the exact probability. Informed consent must include managing expectations based on individualized chemical regimens, not just marketing brochures. Compassion requires scientific truth. By utilizing evidence-based medicine and prioritizing psychological well-being, we can navigate this journey with compassion. Follow healtalk.org for more medical science facts. Wishing you healthy and peaceful nights.